So as a nurse, we need to really assess for those risk factors. And how do we do it? Well, we ask specific questions on admission. And your documentation, the paperwork that you're doing whenever you're admitting a new patient, is going to have questions similar to this. And if you have a patient who's coming in for respiratory issues, you want to be thinking in this realm. Next, where do you live? Where's home for you? Are they from a long-term care facility, like a nursing home? Are they an inmate in a prison, which you'll usually be tipped off for that because they'll have a guard with them? Or do you live in a homeless shelter? Also, do they use drugs? If so, what type of drugs? Because we're looking for really IV drug use, because that not only puts them at risk for tuberculosis, but at risk for HIV, and having HIV dramatically increases the chance of them having tuberculosis because of the weak immune system. Because in some countries, they give the vaccine to prevent tuberculosis because they have high rates of tuberculosis, called the BCG vaccine, also known as the Bacillus Calmette-Guerin vaccine, and this prevents tuberculosis. But the thing you want to remember with this vaccine, and I would remember this, that if your patient has had this vaccine as a child, if you give them one of those skin tuberculin tests, the PPD test, they will have a false positive because they've already been exposed to the Mycobacterium tuberculosis. Their immune system recognizes it because they had a vaccine. So they're going to have a false positive. So it's best for them to have like a blood test, which we're going to go over the testing here in a moment, and a chest x-ray to rule that out. In addition, you want to ask them about their signs and symptoms, because when active tuberculosis presents, they will have these specific signs and symptoms, which are coughing that lasts for 3 weeks or more. So ask them, okay, you're coughing. How long has this been happening? Also ask them, what does their sputum look like? Are they coughing up blood? Do they have a fever, night sweats, fatigue, unintentional weight loss, chills, a loss of appetite, they just don't feel like eating, or they're having chest pain or pain with breathing or coughing? All can be related to an active tuberculosis infection. And of course, you also want to ask them, have you had a TB skin test? If so, when was it, and do you remember the results? And you'll want to try to access those results if possible.